Hey, how's it going? It's Alge for Simple Lines Anatomy, and in this video we're going to be talking about cycling, riding a bike, and the positions that come with it, and some of the problems, the back pain that comes with it, fairly frequently if you're an avid cyclist. So one of the things we need to say first is that we are pro cycling. How could you not be when you can wear, such beautiful shorts, hot pink preferably, and very, very tight. That's what you want. Anyways, we're pro cycling. We think it's a good form of exercise, but it's not uncommon for the avid cyclist to have some back pain. This is kind of a normal thing, and there's some reasonable explanations for it, some of which we're going to explain now. So the cycling position is what tends to cause the problems as far as we're concerned. There's all kinds of leg stuff you could go into. We're not really going to go into that in great detail now. We're going to talk about the position you're in when you're cycling. So for instance, you'll notice that this particular cyclist is in a general flexion curvature. There's a bit of a difference at the neck, but general flexion curvature. And this is no problem, but the issue is that it's held for too long, and this is oftentimes the issue. So, for instance, the lumbar spine here, this is held in a state of flexion, or what you would call flattening in a lot of cases. And then the thoracic spine is also in that flexion. Now, the thoracic spine can do that. It is made to do that and does that most of the time. Whereas the lumbar spine, this flattening is kind of unnatural. Normally, it goes a little bit more into an extension curvature. It will be relatively forward or down in this picture, but it's not in this case. The cervical spine is actually very extended, mostly at one or two particular points. And this is a problem, not in that extension is unnatural to the cervical spine or neck, whatever you want to call that, but because it's so extreme. We, of course, have to have this position, otherwise you wouldn't be able to see in front of you. Now, you may be thinking, okay, well, that's true of the road bike, which is pictured here, but it's also somewhat true of, say, let me just switch layers, there we go. It's also true of, say, a mountain bike. Say you're holding onto the handles approximately here, and you've got your arm and a head somewhere up here, and you're seated like so. Well, oftentimes people will still bow their back out when we're on that mountain bike, so it doesn't really matter what it is. Also, the mountain bike, and we'll explain this further, has a lot more jarring motions, and this can be a difficulty to the practice of biking. So let's get rid of that. So the spine is being used in a way that's not totally unnatural. It's just that it's being too long, and there's some jarring motions. Leave anything for too long, really, really easy. If you leave anything for too long, it will tend to adapt to that position, and it will tend to stay in that position. It will actually create more fibrosities to do so. Now, the jarring motions, this is a true thing. You may be saying, oh, it's a road bike. There's no jarring motions on the road bike. Roads are perfect. Well, clearly, you've never ridden a road bike before. But in any case, there's always little bumps. There's always little bits of stuff that's going to knock you up, that's going to get you, out of place. There we go. There's a bit. Road bike. So bumpy stuff. Even if you're on a proper road, it can be very much the case that you will experience impact force of some type. That road will either have maybe, I don't know, a tiny rock on it or something like that. Something to that effect. And this force will be transferred up the bike into the spoke, let's say, up the arm through the handles and down the spine as more of a compressive force. We are fixed here on the seat, and we are being loaded this way because of the force transference through it. So this is quite relevant. You are getting impacts, and with every impact, that's going to change the way in which the body receives that stress, especially in this position. So as we get into these positions, there'll be certain apexes of curvatures, certain points at which the flexion or the extension we're talking about is the most extreme. So let's say, for instance, right about there, or right about there, or right about there. Any individual one of these points could be the potential apex, the most flexed point of that curve. And so if that's the case, it means these things are being pretty loaded heavily. Now, I'm going to give you a few more specific examples in a second, but the fact is there's two really simple ways we could look at this. If it just so happens that you have a point where it is pushed too far apart, you get strain and usually pain with it. It gets pushed too far apart, say on that posterior tissue, you get a lot of strain. And one of two things will happen. You can either go into laxity, in that the ligamentous or muscular tissue, let's say it's at a bunch of different points, will start to loosen up and it'll allow for a lot more movement now. More movement than it should, it will become unstable. Conversely, instead, what it could do is start to contract up around the area. It adds a whole bunch of muscular contraction and it sort of stitches it back together. And it makes it so that it doesn't move any further than it's being forced to. But the problem with that is it doesn't move like it used to. It doesn't move as much as it did before. And this is a bit of a problem because we need lots of movement. Now, the truth of the matter is, and this is a bigger concept than we need to address here, oftentimes the points of hypermobility, the stuff that's moving too much, let's say it's right about here and right about here, will be forced to move even more excessively by the points that don't move at all. So if this is not moving and the green stuff is the mobile stuff, it's moving excessively, you'll find that as the force is transferred through the body and it tries to move this stuck spot, it will be transferred because this is really stuck. That's not moving anywhere. It will force this area in here to move way too much. So it'll go kind of crazy. It'll go too far into the position that it's already in. And that is just generally true. So I'm going to now give a few examples, some specific points at which these things can become a problem in this position. And this is going to be helpful because if you are a cyclist and you have some back pain or you have some problems, this can be used to help you. This can be used to help structurally diagnose you. So first one we're going to pick on is that L1, L2 area. And we're picking this kind of arbitrarily. It could be anywhere. It doesn't have to be in that area, but it is a common enough area. The thing about the L1, L2 area is that it's right at a point of transition. So we've got this, again, thoracic curve here, and it should go into a nice smooth extension curve through here. But in this case, it's not being allowed to. So because it's a transition point, it should be flexed at the top of the lumbar spine, extended down below. So normally this L1 and L2 area does a fair amount of flexion. And so if I take everything and put it into a hard flexion, it will really flex up that area. And let's say this is our L1, L2 area for reference, and it's doing this now. It's doing that flexion curve. It's doing that. It's coming basically like this. It's being compressed this way, if you will. Ooh, missed one. There we go. Missed one. And that also means that it will take on, because it already wants to move that way, just like we're talking about, it will take on that flexion much better than, say, another area closely related. And so it takes on that flexion well and it flexes even further. Now, when we have a flexion curvature, like so, it stretches out what's in between it, and we have a fair amount of ligaments, and we have a fair amount of muscles running through here. So there's going to be some muscles, which we'll do in purple because we've used upper red already. Fair amount of muscles going like that. And so as these come apart at the back and come together at the front, it will tend to separate these tissues, and you'll get some strain in this area, local. So that's some localized pain. Now we also get some compression on the other end, because if one side's coming apart, the other side's coming together. So these discs, and even though I wouldn't say this is a huge problem, these discs are under a bit of pressure here. So not that that's saying like they're instantly going to rupture or herniate or anything like that, but because they're under constant pressure, they have a tendency to have trouble moving, and they have a tendency to have a little more trouble refilling, because discs do need to separate. They have to have time in separation to make it so that they can refill with fluid and redistribute the weight between them. So that's really important. Now I'm going to hit on one more thing I feel is important anyways. Let me just get rid of some of this. Now, what can happen, and this can be a bit confusing, is that you get low back pain related to this, and it's not that it is actually low back. So let's say I've got a bunch of pain coming from right here. It's a common one. It's right at that lumbar sacral junction, L5, S1 kind of region. Now, because this area is flexed in here, we've got a good flexion through here. Let me make that a little more identifiable, though. Let me just get the right brush. There we go. A little bigger. So there's that flexion, give or take, right there. And as that flexion is there, and as this is flattened out, the lumbar spine is flattened out, tends to be that the tissue slack between these 2 points is reduced, slightly smaller size. There we go. The tissue is reduced in slack, so it's longer. So it means it's being pulled on harder. And it's being pulled on mainly because of this curvature through here, this flexion curvature that's not really supposed to be there at this extreme. And as it pulls down, there's tendons, shared fascia between all these posterior tissues. These would be like the erector spinae muscles and the lumbosacral dorsal fascia, all through there. It's all the same stuff. And so as I pull this area here, it starts to strain this area in here. We start to get all kinds of pull in that region, and it starts to potentially separate tissues, small tearing, which is quite painful. It's not a nice feeling. And that can mean that you can't really fix this pain in this situation until you fix up here, for instance. Another thing we want to talk about is the cervical curvature in this case. So there is a good deal of extension through here, and it's not really even extension at this point. This would be more like a translation. So when it comes to the cervical spine, we have kind of the same thing we have everywhere else. We have a lot of muscles in the posterior, and they're going to be contracting. They want to keep this head up. They want to keep the head like so and looking forward. If we don't have that, we'd be looking at the front wheel all the time, and that would be pretty useless because things are further away than that. You know, things you could run into like cars and other bicycles, actually. So anyways, with that muscular tension here, it's not so much that that cervical spine is extended. It's actually being pushed like so. So as that disc or that vertebrae, as it gets into extension, the cervical spine has the ability to translate down. I've drawn it quite extreme here, but I'm going to just do a slightly different version. So if you're looking at the cervical spine and neck, there's like C2 and C1, give or take. And then there's C3 and C4, and I'm going to say C5 is probably your worst one. As that neck gets to be into an extreme extension that we've shown in this case, a very, very significant extension, its facet orientation will allow for a little bit of anterior glide. So it's going that way. Basically, that's your extension right there. And so it's as if it was being literally pushed forward like so. And that push, really the tension, because we've got a lot of muscle here, tension and pull will create an allowance for movement of the vertebrae slightly forward. And there's like that's the SP. Notice that it's no longer congruent with these guys. It's no longer congruent with everything above it. And this is further increased by the fact that at this angle, the biker's position, gravity is actually pushing down as well here. So it's not just a matter of the muscles creating tension and compression in the back, but it's also gravity pulling it down as if it was being yanked down. Now, this is not life-threatening. This is not a problem. It's not going to sever anyone's spinal cord, but it can be quite irritating because we have some important ligaments that run through here. And as you push into those, the ALL, for instance, that ALL is going to go on further tension, and we should get some noticeable irritation and pain coming from this region. So that can be a real problem over time. Now, ultimately, the issue is that at one point or another, if you're going to be doing this and if you're going to be putting in these kinds of extreme positions for long periods of time, you need to come out of that position and stand up like a normal person and like reach the top shelf at one point, if you're so inclined. If you never want to do anything but biking, no problem. You know, if you're basically always like this, there's your head and your neck's in extreme extension, and then your pelvis is there. We've got the weight. Really, we've got the weight of that head is now forward. So there's your thorax, for instance, lumbar spine. There's a hip. The weight of your head is now relatively forward. And this maintains this position when you actually go to do things, when you actually want to go and behave normally and, again, reach the top shelf, for instance. And so this is a problem. We have to find a way to undo these things. And for some people, it might be stretching, exercise-based therapy. This is very good. If you can find someone who really knows how to encourage you to do that well, that's great. Or when it's a little more extreme, when the rigidity is just too much. It's always good to consider someone who's in the manual therapy world who can quite literally reduce the thickened tissue, remobilize the joints, and get you up and moving and reacting normally again. I hope that made sense. As always, we're Simple Lines Anatomy. You can find us on Instagram, Facebook, or Twitter, and we also have an app, which hopefully is of some use to you. Have a good one.